Image in front of you is that of the gallbladder of a 65 years old female with no pain and a lump felt in the region of the right hypochondrium, and she does not feel any pain except for a feeling of a mass. Now this frozen image shows you the gallbladder. This is the gallbladder in length, measuring 12.3 centimeter. More than 12 is normally considered to be as an eye length, and 5.2 centimeters in an anterior-posterior diameter. It's full of debris, echogenic islands scattered all over, with a 13 mm or as 12 mm calculus seen in the GB neck region, along with a tiny, this one, rounded echogenic area in the center of the body of the gallbladder. Now this gallbladder, as I will show you, has multiple islands of thick echogenic, is full of the gallbladder. This is the outer wall of the gallbladder, and this is the fundus region. This is the body of the gallbladder, and these, you see, it should have been as black as this region and filled with bile. We do not see any bile, rather all of the fundus, body and neck of the gallbladder is filled with these echogenic islands which are fixed, non-mobile, in which scattered tiny calcifications are seen. Now, as I move towards the neck region, this is the neck, small amount of the bile is seen. This area shows clear bile with calculus in this region as well, measuring 14.4 mm, and this is the portal vein, and so what we are seeing is a GB mass, in fact. Now this is the transverse section of the gallbladder. Here I am showing you the transverse section. It's full of echogenic areas, islands of echogenic area, and in transverse section it measures approximately 5.5 centimeter, and gallbladder more than 5 centimeters in transverse section is considered to be a dilated or distended gallbladder. The interesting thing is, now if you measure the wall of the gallbladder, then the wall measures 2.3 millimeter, up to 4 is normal, so wall is not that thick. This is a magnified view of the gallbladder. There is no evidence of intrahepatic bile duct ectasia, no dilation of the intrahepatic bile ducts. This is the portal vein, patent, and here this is the portal vein, patent, not dilated, and important thing to see is the status of the common bile duct. This is the GB neck region, the portal vein. This is the common bile duct, this one, and it measures 5.5 millimeters, is not dilated, up to 7 is considered normal. And is it really a CBD? Here you can see no flow will be seen. This is the portal vein, this is the CBD. It runs, and we know that the common bile duct runs anterior to the portal vein, and the common bile duct does not show any flow. So is not dilated, does not show any flow. Important thing to see is the status of the gallbladder in painless distension and dilated gallbladder. Now you see this is the pancreas in transverse section. This is the head of the pancreas, splenic vein, neck of the pancreas. This tubular structure is the duct which is not dilated, splenic vein, superior mesenteric artery, the aorta. So there is no pathology seen relating to the gallbladder. This is the head of the pancreas in longitudinal section, and there is no evidence of any mass or focal lesion relating to the gallbladder. This area is clear. There is no para-aortic plain adenopathy. There is no adenopathy seen relating to the region of the porta hepatis, and no dilation of intrahepatic bile duct seen. However, now there is another thing to show you, and it is, see this area, vascular area seen posterior to the body of the gallbladder, which is vascular, and I am talking about this region. This is a focal lesion, focal mass lesion in the liver, separate from the posterior wall of the gallbladder, and it measures approximately 2.5 into 2.4 centimeter, is hypoechoic and has vascularity within it. This, see, it does not relate to the gallbladder. Here we are. In the magnified view, you will observe that it does not communicate with the gallbladder. Now I am giving a sweep to the probe to show you that whether it changes its shape or not. It does not change its shape. It remains globular, and here is the posterior wall of the gallbladder. It's separate and posterior to the posterior wall of the body of the gallbladder. So there is a focal lesion seen which is vascular in the body of the pancreas. See the vascularity, degree of vascularity of this focal lesion. This focal lesion. So there is a focal lesion in the liver as well, and the liver is outer surface of the liver shows irregularity. So case of chronic liver disease, you see the outer surface of the liver. This is the outer surface of the liver, and it's irregular. The echogenicity of the liver is raised. Gallbladder, focal lesion, and the liver. See the liver. Liver shows coarseness with diffuse increased parenchymal echogenicity. So this is a coarse liver, or liver with diffuse parenchymal changes, chronic liver disease. Here we are. So this is our case of the day. Thank you very much.